time you gotta put a date between the meetings.
Let's call ourselves to order. It's 3 o'clock on Monday, April 13th, March 13th. Okay. So any members of the public? Okay. Approval of the minutes from last month's meeting. Looking for a motion to approve.
I move to approve
Thank you,
the
Harold.
minutes of the February 13th ADRC committee.
Okay, and 8 seconds. Any editorial changes either in the room or for folks on Zoom? Going once. Sold. Approved. Okay, Beth, you want to talk about conflict of interest?
Absolutely. I'm going to hand out, here's for you and Kate. And then, I don't know, did you get yours in the mail?
I copied it.
That's okay. If you don't have it, oh, looks like Rob's coming. I will,
I have this.
I have. Okay, you want to give that one to Rob? I don't know if he, I don't think he printed it. So the reason why it's on the agenda, even though I had mentioned at the last meeting that we're going to, I need them signed annually. Is that I wondered if there was any questions, because the change is that before it was about a 2-page supplement that explained what conflict of interest meant. And I forgot I should be looking at the L, what conflict of interest means. And this time it was about an 8-page document. A lot of it has to do with the ADRC staff that have to sign this annually. So it's hard because much of what you read is not applicable to what you do as a county ADRC committee member. But either way, it's the form that the state has come up with. And again, anybody affiliated with the ADRC, such as staff, committee members, whatnot, have to sign it annually. So we're a little late in the game with doing it in March instead of January, but we have them here for you to sign. I don't know, Jan, tomorrow, if you got yours, if you're going to send it to me, if you want me to mail it to you, email it, what would you like me to do?
You can email mine and I'll print it off when I get home. You're not going to get it until after the 1st of April.
Not a problem.
I never received one in the mail, but I'm happy to sign it when it comes.
Okay, just regular mail?
Sure.
Yep, okay, not a problem. So are there any questions or concerns with the conflict of interest?
Yeah, I had a few.
Mhm.
On the bottom of page 1, second to the last line, we talked about aging unit or tribal ADRS. Is that a misprint?
It is not. When the tribal communities in northern Wisconsin formed their resource place, it's not a center. They decided to name it Aging and Disability Resource. It would
Center?
services, Aging and Disability Resource Services, I believe it is, but it's not a misprinted. They named theirs a little bit differently than the non-tribal ADRCs.
Oh, okay.
Yep.
Okay.
I have a question on pages 8 and 9. Are we supposed to sign both of them?
No, jump to the end here. You are only supposed to sign.
Left page.
The page 8.
Pages?
Yep.
And I still in the line, Winnebago County, right?
Correct.
Who's the supervisor?
Sure. Again, Brian's staff have to sign this annually, so normally they would put Brian on there, but It's just an odd thing that they melded them into one form. Thank you. Rob, any other questions?
Yeah, going back to the beginning of the ADRC in 2010, I recall having been on the long-term support committee, which was prior to the ADRC. And there was on page 5, I remember at the time that the people who were on the long-term care committee were getting services. They were either going into family care or IRIS. And it was a rush process, as I recall. And I don't remember if the top one, the customer signs the customer service agreement. And then it says what it is, and then at the onset of option counseling,
Which page are you on?
I'm on page
Okay,
5.
okay, I got it.
The pages are kind of different because one is they're not the same side over, you know?
Yep.
And what I'm curious about is I was wondering, what is the customer service agreement? Is that a form other than this?
It is. Brian, do you want to give a little bit more detail about the the
I'm looking at page 5.
the customer service agreement? When someone is agreeing to options counseling, I believe it's a rather newer form too. We didn't have to do that before.
Yeah, to me, it's just, here's the procedure. That leads
I don't have any recollection of it. It's been a while. But as I said, we were rushed into it. So,
Well, back in 2010, that form did not exist.
oh,
So it's relatively new.
yeah,
And I don't recall exactly when it came out.
wondering.
Am I right? I've been thinking that it's just when we go to when we do options counseling, we're proceeding from just essentially talking about options that are available to some pretty specific options counseling,
Mhm.
which is gonna lead to an enrollment counseling. So I think that's where
Which could lead to an.
draw the
enrollment
line in the
counseling,
sand.
Yeah.
And does that create a conflict of interest? Any of that? I think the form is signed to not have conflict of interest, right? So we are completely above board in our administration of what we're doing as a team to the customer.
Yeah.
I take it.
So essentially, Rob, the state has put a lot more emphasis on options counseling. We provide information and referrals and assistance and resources to all kinds of people. That's really a lion's share of what we do. And then when a person's looking at different long-term care options, we provide that options counseling. And this is the formal form that they now sign saying, okay, we're gonna, like Brian said, formally talk about options counseling. And then when a person receives options counseling, they may decide to pursue family care or long-term care in some way. And then that would lead to functional eligibility, financial eligibility, and enrollment counseling. So the options counseling is just a formal way to say we are now officially talking about your options. And I don't remember what's on the form.
I was
I could
wondering if
pull
you
it up
could
right
give me
now.
That form a little later.
Sure, I can even pull it up right now, I believe.
I think what threw me a little bit is that the state, we've had a form that goes with every one of our enrollment packets that talks about, did our staff talk about all of the options that are available to people, meaning family care, meaning now family care partnership, which is a new program, Iris. And the fact that they could just take Medicaid's card services. We've had people sign that since 2010, so Medicaid and ADRC. And I believe this form is kind of operates in a similar fashion, but ours was just a local form. It wasn't a state of Wisconsin form.
Yeah, I can pull it up again in case there's any questions about how that works. And forms. And it's, which form is it? It's on 2923.
All interest.
2923. Oh, sorry, let me get this off my screen.
Yeah, you might be able to click on that link. For customer service.
Could you speak up, Brian?
Sorry. When she's signed into her Luna. And then gets out of there, you'll notice there's a link there for the customer service agreement. Maybe we could double click on that is what I was saying.
Because I don't remember that either. So,
All right, so we're looking at,
No.
no, that's 3093. We're looking for 2923.
Can you do a control F, which is a find? And put in 2923?
I can. Okay, so that's the form that's up right now. Is the actual.
It's the whole thing.
Mhm.
Yeah, if you look at the bottom.
It's this form right here.
it's just.
Yep.
Okay.
Oh, customer sign. 03A though. So there must be an A to this. Let's keep going.
You put in a dash 038.
I certainly can.
No, you got a 4 in there.
Okay.
And there's only one occurrence of it.
You're pretty good at this.
Right, but it's simply referring to what Rob's reading right now. It's not showing us the form. Huh.
There's a search there.
That was more detailed, but. You know,
Well, I think what I'll do is I will try it this way. And if not, we can just move on. Interesting. We have a state like liaison, an RQS who we can ask about this.
okay.
What that Form A is.
I'm sorry, I'm being picky, but.
No, that's all right. You deserve an answer on that. Customer sign it.
Because I'm kind of ignorant on the whole thing, what, if we look at staying on page 5. The director and management responsibility, agent responsibilities. You said that this is really intended for staff. And so are we just filtered in here?
Yeah, they
Okay,
just
and if
basically
we
added.
are, what, is there any liability from a standpoint of, what if I phone this? And what is the penalty, or what are the penalties?
Um, I'm gonna jump in. I don't know. I think if you're worried about liability, I would think that that's a question to ask a personal attorney. I'm worried about the committee taking a position on that.
And I thank you because I can't tell you what liabilities you have. You know, we as an ADRC don't punish people for that, but I can't speak overall in regards to liability.
We're not actually board members. We are not policymakers. We're an advisory committee.
Okay,
So if this was actually a board where we were making policies and whatnot, if you would have errors and omissions insurance.
okay,
And since we're not doing any of that, I don't think there's any liability involved.
okay.
The other thing I would suggest is that the county's, I'm sure, has got some owners, directors, commissions, you know, liability coverage as well for all their board. But it'd be,
We do, but as Kate said, you're not a board, you're a committee.
And so we're not making policy.
correct.
Okay. Thank you.
Question for you, Beth, as I realize it's in the weeds. There's something on the current budget being considered at the state level to bring all the ADRCs to, you know, an even plane in terms of funding. Does that mean it also will, you know, make all of the policies and procedures even across the different types of ADRCs that exist?
Yeah, right now, the scope of services and the operations manual apply to all of us.
Okay,
What you may have seen in the current governor's budget, which we don't know where that's gonna go, is some increased funding to assist the inequity, because for those of you who don't remember, the original ADRCs that were formed, or Generation 1, received a lot of funding, and they're able to do a lot of preventative care. They're just able to do a lot more than other ADRCs. And then there was a Generation 2, and we're actually Generation 3. So we have funding to do the required, I don't know. The required stuff. I was going to say, do we have the funding? Because we're barely skimming by, trying to get done what we have to do from a scope of services contract standpoint. We really struggle with doing the above and beyond stuff. And as referrals continue to increase, we're struggling to even get through with what we have to do. So the funding would be to assist us with just regular operations for the most part. I don't know what we'll see, if anything, though, in the end of the day.
thank you. Any other questions or comments? Okay,
All right.
next we'll talk
Um,
about,
Let me just check in with Liz. Liz, are you going to be sending me the conflict of interest? Do you want me to email it to you? Do you want me to mail it to you?
Was I supposed to, did I receive it by email and I just missed it? I apologize if that's the case. I didn't.
Thought it was an attachment to the agenda and notes.
Yeah.
Okay,
Oh,
yeah,
it
it was.
was, okay. Then that was my mistake. Then no worries. I'll print it tomorrow, sign it, scan it and send it to you.
Awesome, thank you.
You bet.
That's that.
public health emergency.
Yeah, I just
Follow-up.
wanted to follow up because Paul had asked a question last month about number of people served, and it's about 20,000 by our county. About 10,000 get food share and about 10,000 get Medicaid. You know, it changes by the day, but just giving you some statistics. We have not heard a ton about the food share yet. Granted, we're only 13 days into the month, but we haven't had a lot of calls directly about my food share isn't what it used to be. People were well notified, and really they're supposed to call the consortium number through economic support. There's nothing that we can do specifically about that. But we haven't really gotten inundated with food share going back down to the pre-COVID level. And then with the Medicaid reviews, those really don't start till June. So I would anticipate in June, we're gonna get some disenrollments. How many, we don't really know. But I just wanted to give you more specifics that I didn't have available last month.
Any other questions or comments on that subject? Wheelchair wash.
Well, we have it narrowed down to either June 10th or June 24th. We're just waiting to figure out who's going to provide some entertainment and verify the inspector can inspect the chairs. So it'll be one of those 2 dates. We had our first committee meeting last week, and then we're gonna have another one in April to kind of solidify things. But really, it's a pretty smooth operating thing. We know what to do, when to do it, and how to do it. We just have to verify the date. J&R Auto would prefer the 10th, so I'm thinking it's gonna be June 10th. They're allowing us to use it on the 24th, but their preference would be June 10th. And then
Which day is it not gonna rain?
I know, because you know that whatever one I pick, the opposite day is gonna be the better of the two. We are still looking for a couple, at least one or two larger wheelchairs, or the bariatric size wheelchair. So if anyone has availability to get one of those, let us know. Right now, we use the ones here at the ADRC. Public Health has one. Parkview is hopefully going to come through again. They gave us several last year to utilize. But we're still looking for.
While their chairs are being.
Yep,
washed.
so they transfer into a loaner chair. We completely scrub down that chair, dry it off, inspect it while they have a free lunch and listen to some entertainment. And then whenever they're ready, they transfer back into their typical chair. And
Do you have a representative from the Lions Club now?
no, Pete had been, but he said that they're really short-staffed and they haven't been able to offer anybody.
So do you want me to reach out to them and ask them if they have one?
That'd be great.
I will.
So we got plenty of time to run out there and pick one up and get it back to them. Questions, comments about the wheelchair wash? Okay, cruising right through the agenda here.
Yeah.
A couple things that I have. One of them is we are at a point of sort of reassessing our role with the falls assessments. As you remember, we have a relationship with the fire departments and public health, and now the senior center's gotten engaged, as is, what's the company that does the grab bars? Help me out.
Rebuilding together.
Thank you, Rebuilding Together. So it's great that we're all partnering to help prevent falls in our community. However, it's not going necessarily very smoothly, because what happens is if someone falls, the fire department is simultaneously sending referrals to the senior center and Rebuilding Together and to us. So when someone doesn't respond to us, we don't know if that means that they're engaging with one of the other entities who's helping them, or if they're not interested. So we need to reassess our process for what the fire department does. We still will be partnering with them and engaging in this. But I think it's gotten a little bit, the number of referrals has gone up significantly, but yet the number of people getting back to us isn't gone up proportionately necessarily. And so we're just not sure what role each of us should have, and it's being reassessed. Next month, I'm going to be off quite a bit in the next 4 weeks. And so next month's meeting is on April 10th, sorry. And I will be coming back a couple of work days before that, and I can quick put together an agenda. But we were going to postpone the voting on the chair and vice chair until May. And I don't right now have a meaty April agenda. So I'm wondering what your thoughts are on skipping our April meeting and just meeting May 8th, which is when we would do our elections.
I think that sounds like the way to go.
Yeah, because I mean, if there was a bunch of stuff on our docket, I would say, you guys can help with the agenda, and thank you, Liz. And Paul can still conduct the meeting, but if not, I think we can just skip it and Jan, you'll be back by May, right? Yeah, okay. All right, so we're gonna
Yes.
skip April and we'll go with May 8th will be our next official meeting then. Trying to think of what else I had to share. Even though it's not part of the ADRC, because a lot of our ADRC customers are, particularly our elderly population, are impacted by housing instability. Our help program continues to just thrive with referrals. It's really, really cool how they're able to interact with people who are at risk of becoming homeless or being evicted or losing their home. They've been just doing a spectacular job at having that proactive approach and helping people out. We have a new APS. One of our APS staff is going to be retiring, so we are looking at a new person that we cannot announce yet. We don't have a announcement to make. And then the other opening is openings. We have Kim, who left the ADRC last month, and we've chosen a candidate, but don't have a signed sealed offer to share that person's name. And we have another ADRC person retiring end of March and end of May, yeah, good. End of March, end of May. So we've already interviewed and have a candidate for the upcoming opening, so we can maybe even have a little bit of overlap. So we've got a gap right now with Kim's departure, waiting to find out if this person can start and when, and then we have the upcoming retirement that we will definitely have somebody in place prior to that person departing. So that's with the ADRC staff.
I have a question.
Mhm.
You hired 3 new people. I think with the help program.
Mhm.
Are they gonna come to a May meeting or a June meeting?
I could have their supervisor, Sarah, come.
Okay, good.
Yeah,
Do it the nice way up in the EDRC newsletter.
yeah.
Okay.
Excuse me.
You could have some facts and figures for the presentation, that would be good.
Yeah, I can kind of remember verbatim what the statistics are. There's been about 118-ish referrals. And which is a lot for the 6 weeks of the reporting period. They started middle of January and this was through the end of February. So that's quite a few referrals. They have managed to keep people in stable housing, about 40% of the referrals. And then out of the other people, it's close to 50% that they've been able to successfully work with. Out of the other, almost half of that half, so about a quarter of the people that were referred are not able to be contacted. They're just not engaging with us. They may have found housing, they may have gone to another county. We're not sure what happened. So we got an initial referral and we're not engaged with them, nor would we consider them to be a success. So yeah, we've close to 60 that we've been able to successfully keep housing for, maintain their housing, and then around 30, not quite 30 that have disengaged and we're not sure why. So those are the numbers. The number at the board meeting, I shared a couple of examples of how they work with people. So one would be a person who is being evicted due to too much police contact, which is a real thing. You can be evicted for being, causing disturbance. Sometimes people even put that in their lease. And the person said that there hadn't been any police contact. So what we did is we contacted that police department. We had them run a report of all contacts at that address for that person during the time that they were living there. And the report was blank. It was empty. So we printed that out. The person took it to their landlord and the landlord had made an error basically and said, I'm sorry, you're not being evicted. I had wrong information. And so that person would have left, they would have been evicted. So they would have left their apartment. They didn't have a place to go, which is why they contacted us, and they would have had an eviction on their record if we hadn't advocated for the person to better understand. So a lot of it is tenant rights. We've gotten involved with a ton of tenant rights. But that would be an example. The other kind of high amount of stuff that we're experiencing is older adults who are feeling like they have to leave their residence because they can't maintain it anymore. Either they can't care for themselves or they can't care for the residents. So we have either helped link them back to the ADRC to see if they might be eligible for long-term care. Some of them already had long-term care, but apparently the care management organization wasn't aware of exactly what was going on, and so they've bumped up the services that they needed. But just getting the appropriate services and supports to those people has been able to maintain several older adults in our community in their residence. So that's another success. We're doing well, yeah. But yes, I can look at having them, May would do for the election, and then Elisa would typically be due to do a presentation too, so we can either have her do it that month or June. Anything else for me?
I have one question for you. Some years ago, Cole's predecessor gave our group a report on seniors involved with were victims of fraud in the sheriff's department. Do we have like 2 or 3 years worth of data? If I
Can we do
remember right,
it?
the numbers are going up
Report?
pretty precipitously up. And I'm curious if that's still the case today, or is it going?
It's going up.
Okay.
I know we have the numbers from last year because now we have to turn them into the state every year. So I know we have 2022. I just have to look back and see if they were tracked prior to me.
Mhm. They were,
It'd be on the APS tracking form. There's a financial exploitation one.
Yeah, that's the one.
Yeah. It also though does involve staff actually putting them all on there. So
consistently.
now I track everything. So we'll have the perfect numbers this year.
Well, and the other thing in the staff's defense, is that the state didn't have the best guidelines. So some counties were putting every single guardianship on there. So it could be a person who has a developmental disability, they're about to turn 18, and we were petitioning for them, the parent, to become guardian because of financial reasons, the family couldn't do it. That's not elder abuse, or that's not abuse, that's not adult at risk abuse, that's not abuse. But some counties were tracking every single guardianship they did in that report, or some were only putting in, for example, cases that were substantiated. You're supposed to put any allegation of abuse on the report, and some were only putting substantiated cases. So the state wasn't giving the best guideline as far as
They still haven't. We've asked in like every quarterly meeting, like, can you give us guidelines so we know how to track? And every meeting they said, we're still working on that. And they had a work group like 2 years ago so every county is tracking differently. So there's not a way to even pull statistics from the state because everybody's doing it differently. So I just started tracking our own.
Well, we could certainly we know in a rough way.
Yeah.
The numbers of seniors. We do kind of a per capita of X to Y.
can you
over-
separate the from elder versus adult at risk on the report?
Yeah, they have the age.
Thank you. Anybody else who needs to ask Beth any questions? Come on. Okay.
Let me off the hook easy today.
Okay. Rob, committee.
Yeah,
Well,
the thing I have to report on is I did attend, commission on aging meeting.
For City of Oshkosh, is that, or is that the City of Oshkosh Commission?
Yeah,
on
the
the-
city of Oshkosh, and it was so surprising, I ran in, and I looked at the screen and it had ADRC written on it. And I wondered, what in the world is going on? And sure enough, Brian was there. And and then I also ran into Ron Durkop. He was there too. And Ron had retired from the committee. Did you take over his job or?
Pardon me?
did you take over her
Yeah,
job?
when he retired here,
Yeah,
yes.
okay, I couldn't quite remember that, all the. And, but it was informative, it was a short meeting, 8 to 9, so. But, yeah, that's the only thing I have to report on.
Okay. Jim?
The other thing that, I tried to attend the Nina committee on aging, and they had the meeting canceled, and
Oh,
I didn't know until I got there that it was canceled. I also tried to find what Menasha has for their group. They don't seem to have the same thing that Nina has. But I just wanted to go just to sit and see what they talk about. And
they meet monthly, so hopefully we'll catch the
Manisha.
next one. Nina,
yeah, I haven't gotten the new notice yet. I'm on their mailing list.
good. Yeah, you can report back to us then about what.
Okay. Well, and I was going to go as just Jim who lives in Nina. And just
Mhm.
to see where that is. But do we know what Menasha does? Do they have anything? Because I called the city clerk and asked if they have something similar, and I haven't gotten anybody back.
Yeah, I don't think the city of Menasha has such a committee.
Are they in a different ADRC?
No, no, there's the Menasha Senior Center. But they don't have an actual committee, like a, Oshkosh Committee on Aging and Nina Committee on Aging. Menasha doesn't have one. And I don't know that they have anything comparable.
Never heard of anything.
Yeah,
Well, I'll dig on it, see what I find. I just don't see anything.
yeah. Nicole and I are meeting with the Amro Community Center Thursday, I think it is, to find out what their intentions are, because they don't have a site, so they don't have the site that they had been previously using for years is not available to them this year. So we're meeting with them to find out what Amro's intention are, and then Winnie, nothing formal.
Nicole, you go to the new one once in a while, don't you?
Sometimes,
I
yeah,
think I've seen your name on the minutes from there.
yeah, I have gone. Lori Duclon also goes and sometimes she comes here too. So I get the minutes and I read it, just to see if there was anything important, and I know that, like the biggest thing that they do is they do like a school for seniors event, and I think it's in like September. And our APS staff usually does like a presentation on scams for it. But yeah, I think right now they're just working on like resource lists for Nina. And we already have the resource directory, so when they send me their resource list, I usually send it to Brian just to see, is it something valuable? And they just sent me a housing list and I sent it to Melissa. She usually knows everything. And I said, is this valuable? And she's like, no, this is basically everything we already have, so.
Do we want to let them know that they're kind of reinventing the wheel? Maybe? It seems like work that doesn't necessarily need to happen if we have that in a book, not maybe popular conversation.
Yeah.
Save them some time.
Yeah. I think they have the directory.
They do.
No?
Yeah, I'd like to give an update regarding Advocate senior meals at the Oshkosh Senior Center. I've been going there since the first year. I've been told that prior to the pandemic, they used to have more than 30 people at a time there for those meals. I've been going there one day or 2 days a week since the first of the year. And there's never been more than 2 or 3 people.
Wow.
Wow.
And they're advertising the thing within the senior center. And I don't know if it's being advertised. I know, and it's in that senior center
Yeah,
monthly thing they put out. But
there were a lot of
and
people.
I don't, and they claim they have there's paperwork you have to fill out before you can even. And then I've been told they have more than 30 people signed up, but I can't understand why nobody's going there. The
No.
food is good and the service is good. The lady who runs it is
Yeah,
very good.
And I know some of the
why
people
they-
going weren't necessarily regulars at the senior center, so maybe they don't know, but either way, that's a big difference.
Yeah, I know it is.
I
I don't know why it is. I can't understand. They claimed before the pandemic, you always had a big turnout.
Yeah, they did. Yeah,
Delivering more versus people coming to this.
there's no more deliveries unless you're homebound.
But there's, I wonder if they haven't finished reevaluating that. We'll have to check. We're checking in with them. In April, we have a meeting.
Or
scheduled
maybe
with
they're
them.
doing grab and go still. They were doing a grab and go where you can grab your lunch and take it with you. So they might still be doing that, and the people just aren't dining there, but we'll have to find out. And
Yeah, they have that option. Yeah, they do.
But technically,
Like
they're
one day
not
I was,
supposed to anymore.
No, they're not.
one thing they changed. Again, it's my understanding, changed it from the past. Is you have to sign up a day in advance. You just can't walk in the place and say, I want to eat today. There was the last meeting of that, this gentleman came in there, he wanted to eat, and she said, have you signed up? No. Well, I can't help you.
Yeah, yeah.
See, in other words, it's my understanding that like Canteen and Applin provides the food.
Mhm.
So the lady has to let them know a day in advance how many people are gonna be there.
Yeah, we had a lot of wasted food a number of years ago, a lot of wasted food. People that were signing up and not coming, people, they were making some extra ones and then they didn't need them. So they've definitely tightened it up so there's not wasted food, and they actually freeze some of the leftover meals if someone doesn't show up to use on weekends. But I guess we'll have to find out why, if they're still doing the grab and go, which they're not supposed to be doing, or if they're doing the home delivered still, which they're not supposed to be doing. Because those are the only two things I can think of that would have an impact on who's eating there. That's strange.
I don't know.
I think
It's-
one of the problems was, if I remember on the Human Services Board, the park review used to make the meal. And then it was, now the place in Apple canteen, is
Mhm,
that what you said?
mhm.
Okay. Cause I think that's what happened.
Well, I don't, right now Canteen is providing, and they do a good job.
I'm not saying
I never
you
had a
don't.
bad meal, but
Yeah.
like I said, they had to change it, probably to keep the cost down. You have to sign in advance, you just can't walk in. Now, you can walk in if if I put my name on for today and I didn't show up. And a stranger came in, then you might get, the only other thing too that I could be nitpicking a little bit, but like at the senior center, they do advertise that is available. But one thing I've been told it was an honest mistake, but for example, they explain it's there available and the time and things like that. But they don't explain that donations are requested. And I think they should.
Yes, they should. That's an absolute.
And I was told that was an honest mistake and somebody overlooked it. And then one thing they do. Diplomatically, they do kind of say, it'd be nice if we could donate $4. Cause that's what they figure the cost.
It's actually a lot more
I
than
think it's
that.
a very good program. Like I said, I've been going since the first of the year. And it's reasonable and you donate what you want. They got a little
Mhm.
can there. The food is good. The lady is very cooperative, everybody. The only other thing that's I think a little bit different. If you sign up for a weekend meal. Say you wanted Saturday meal. But for some reason, the policy is they give you Saturday and Sunday. And I don't quite understand why that is. It's not a big deal. I'm just trying to explain the whole program.
That's helpful. The feedback is really helpful because when we meet with them, then we can kind of help to problem solve around some of these things. Because we do the grant funding for it. So a lot of their funding comes from like the Older Americans Act, which we are the ones who report things back to the state. And kind of have to have an idea of how things are really going.
And I'm happy with her and I think Canteen's doing a very good job. I think the lady does a very good job. I imagine, I don't know what Advocate was thinking, they're the one paying.
Yeah, you got a lot for us to think about, and look into though. And I'm glad that the meals are good and everything, but there's a lot of things that you brought up that aren't my understanding of how it's supposed to be, so.
Is that the same as Meals on Wheels? Or is that different?
It's the same program, same Advocate runs both of them. Meals on Wheels is again for people who are homebound. And then the meal sites are for people who can go out to eat. Both of them are donation based. They don't charge people for either one. But as Nicole said, we put a substantial amount of money into the programs.
Well, I thought the Meals on Wheels one, if you got a Saturday meal, you automatically got a Sunday meal.
It used to be that way, and then we changed it this calendar year to be, it's supposed to be 6. Because there was a lot of leftovers.
Sure.
People weren't eating their full meal throughout the week and they're entering the weekend with leftovers, and now we're delivering 2 more meals. So there was a lot of leftovers, and they felt comfortable going to 6 days. And so that was my understanding this calendar
my
year.
understanding too.
It's supposed to be.
Well, and one of the things that we see a lot in adult protective services is going into people's houses who have their whole refrigerator full of these meals. And so it can be concerning that people aren't utilizing them. And so to give more and more meals, if they're not being utilized, a lot of the hoarding situations that we go into is throwing away like freezers and refrigerators full of this food. So
My mother-in-law had the same thing where she didn't have them sitting in her refrigerator, but I mean, where they would just accumulate. So, we were comfortable going from 7 to 6 days a week. But apparently that's not necessarily happening, and I guess we need to find out more.
unless someone needed it. So
Yes.
unless someone was saying, if you don't bring me this on Sunday, I will not eat, and they're eating all of their meals, then we're
Yeah.
fine. But we want to make sure that they're
Yeah.
being utilized.
Yeah, it wasn't supposed to be an automatic, it was supposed to be upon request.
Okay.
Yeah. Either way. So,
Could somebody find out what kind of numbers they're having there? Is it Amaral has one, I believe, and Pickett has one?
Yeah, Amro has one at their meal site, Pickett has one. And then there's 2 other ones in Oshkosh. So we can get a number for all of them.
Mhm.
At least call, I'd be interested to see what,
Yeah,
how the other one. It's strange that people are not going there.
Mhm.
yeah, it'd be really interesting if that one is substantially lower and none of the other ones are.
I
Well, at
get
the
numbers. I
beginning-
want to see if I can tease
I
out
know,
how
know.
many people are going.
At the beginning, that you gotta remember, at the end of the last year, they had a problem. It was a scheduling problem between
Mhm.
Advocate and
Yep.
senior, but they worked that out pretty much.
Yeah, that's why I'm very curious as to whether it's just the senior center or whether they're all lower that much. I mean, that's a big jump.
It's interesting though, because the senior center I do all of their numbers for their programs. They have an insane amount per month of attendees. I mean, over 800 people attend services like at the senior center every month. So there's a lot of people going there. So the fact that they're not engaging in the meals is really concerning.
I
Like,
know,
what's
I
preventing
know.
that?
Every Monday morning, I play cards there, and there's always about 14 seniors there playing cards.
And they all
A couple of
leave
them
then.
sometimes have one to go with.
You brought up some really thought-provoking questions, and wow, I've got a half a page of notes here. No, I'll sleep like a baby, but Nicole and I will look into a lot of this because it really doesn't make sense. So thank you very much for the input. Definitely.
Good.
I have a couple of questions. I have a friend who has, her father's living with her and he's got dementia. And so I suggested that she contact the ADRC, but I don't want to give her incorrect information. Is long-term support based on financial assets?
No. Family care, if you're going like family care eligible, which is the Wisconsin long-term care program, you have to be Medicaid eligible. So it is asset dependent. But there are caregiver programs and there are other free programs that aren't asset dependent. So you can get support, but if you actually wanted to enroll in long-term care, you have to be Medicaid eligible.
No, I think she's just looking for respite at this point.
Yeah, so we still have the free one in Neenah and the free one in Oshkosh. And then we have other respite available through caregiver supports.
And who's she contacting?
Just the main ADRC number.
One of the things we do from options counseling standpoint, when we talk about that, is helping people to understand how best to spend their nest egg on their care into the home. That's a big deal with options. That's something different than the county has always been.
Right.
You know, so ADRC can help people. Because we know the resources, we were talking about it, so how best do I spend my money on the care I need?
Right.
So,
All right, and then back to the guardianship thing that I've gotten more involved in. We still have to set up the meeting.
Yes, we do.
But I'm to the point where with this new board that I have, I should be doing advanced directives and living wills and those kinds of things. Do you have any assistance or guidance? So I don't have to hire an attorney? Do I just download the forms and wing it? I mean, what is the best way to go about it? It's a tough conversation and I don't know the man very well.
Right.
So I'm just looking for a little guidance.
Can a guardian even do that? 'Cause it's really not the person determining.
Did the guardianship training and it said that within the first 30 days, you should be having this conversation. Because
For advanced directives makes sense.
I'm the one that they're going to call.
Yep. I'm gonna check on the guardianship support center through GUAR, Greater Wisconsin Area Administration.
Newsletter.
Yeah, they have like a hotline or helpline on
Yep,
there.
yep.
Did you try that or not?
I have not.
I would try that because they have access to attorneys who can help answer those kind of tricky questions and start there and then let us know.
Okay, sure.
Thank you.
What's his newsletter?
Pardon me?
What's the newsletter?
It's a guardianship support newsletter. I can't remember.
I think it's called Guardianship Support Center.
Yeah, something like that. And they come out with a newsletter. I don't know that it's every month, but
think
it's
it's
at least every
quarterly.
other.
Isn't it quarterly?
Could be quarterly.
Used to be quarterly.
I read them.
I don't get it anymore, but it used to be. No, there's good stuff in there.
Liz, anything for the committee's review?
Sure, hold on, let me just turn on my, well, not, I don't know if this is for the committee's review, why is my, yeah, there we go, hi. Frequently we're asked, do we know anyone who might want to serve on the committee? And I just put the name of a mother whose son has both, I believe he has Down syndrome and autism. And so I believe that, I know he has autism, but I don't know much more about this mom. She reached out to me for help. I put her in touch with the ADRC. I think she had probably already, anyway, but she has a strong interest. Her son just turned 18, so.
Excellent. All right.
Thank you.
Thank you.
You bet. That's it. As you guys know, there won't be a walk for autism this year, but it does look like there might be a group sort of re-examining and maybe we'll host a walk for autism next year.
Okay.
Jan, anything for the committee's review?
No, you were talking about what's available in communities. Winneconne does have what they call a senior center. It's actually at the Highlands, which is the independent senior housing apartments. But I believe it's primarily centered around social activities, bingo and that kind of thing. They may do at most, as far as another service is like a nail clinic through the Valley VNA. But that's the extent of it, just as an FYI.
Thank you.
Otherwise, nothing else.
Thank you, Jan. Tamar?
You're, tomorrow, you're, on the. What do you call it?
Mute.
Mute, thank you.
Yeah, I said no, nothing.
Oh,
Thank
sorry,
you.
gotcha, okay.
Thank you. I don't have anything, so.
Nicole, do you want to talk briefly about the elder abuse? Because that's gonna be coming up prior to
sure.
our next meeting or right around there.
Yeah, so on June 15th, we're working on an elder abuse event for Winnebago County. We're gonna hold some sort of walk. We don't know where to yet. We're working on seeing if we need to have a permit to walk somewhere. Or if we can go to a park for free, or I haven't gotten an
Like what
answer yet.
constitutes a permit? If you put up a tent in the park, does
Yeah.
that mean you need a permit? If you walk there and put flowers in the water, does that mean you need a permit?
Yeah,
If you ask, they'll say, yes, you need a.
Well, that's what I said, is that, it's
Yeah.
exact, I said, ask for, oh, I'm being taped, not forgiveness, but permission, but you know. But yeah,
Elizabeth, you have the answer to us?
Well, for several years, my husband especially, but my husband and I organized the Walk for Autism, which was the largest walk in the entire, I think in all of Northeast Wisconsin for many years. Now, I don't know if you're going to have 4,500 people there, but we
I
didn't
hope
start
not.
out.
We were only doing like 50 cupcakes, so.
Okay, got it. Well, we started off small. We probably started off at like 100 to 200 people, but it grew very fast. Anyway, we started off in Neenah. It used to be, if that's where you're looking, are you looking at Neenah or Oshkosh?
Gosh.
Oh, okay. Probably similar, but anyway, I can't possibly organize it. I have too much on my plate right now, but I'd be happy to find out some stuff, share anything from Friends of Autism with you if that would help.
I'll reach out to you.
Including processes. We used to have a walk in both Madison and in Neenah, and then we moved it to Kimberly, but yeah. So I'm happy to help that.
If this is
Have you
gonna be
looked
the
at-
first time we're doing it, so we definitely do not want 4,500 people.
start small.
Have you looked at the Wash trail system?
45,000 people.
I think the walk part of it's gonna be very, very, very small. I think it's just gonna be right now to increase awareness that we want to start doing something. So the actual walk is gonna be super small. It's more of the, you know, after the walk, having a acknowledgement in a park somewhere.
Have you looked at the Wash system? Like starting out at one of the parking rides?
We haven't, trying to make it very simple and easy to access initially, but that might be an option, absolutely.
So right now, our two options that we're seeing if we can get permission to do is either starting at the senior center and walking to a place called Boat Dock or Boathouse, or starting here and walking to the Sundial Park where the protesters are. And because we would like to get daycare kids involved so we can make it intergenerational. We're gonna be carrying like 60 flowers because there were 600 people who had referrals for elder abuse last year. So we're hoping to have somehow tie in daycare kids to be able to carry the flowers and putting them in some sort of water. We were gonna do Menominee Park, but the whole month of June, they are closed down and not holding any events, and all the roads are gonna be torn up, so they're not allowing anyone to do anything there. That was kind of our whole plan. And so we do have to have a special permit to, I guess, do the one from the senior center. So we're hoping to not have to have a special permit to walk to the Sundial Park. But we were thinking about inviting the police and firefighters, so we don't want to like do something illegal.
South Park is really beautiful. And there's water there,
Yeah,
That's true.
and there's a lot of places to park, and you can.
And it's a circular.
That's,
Small or as large as you want. Just a thought.
yeah, that, we can put that on the table. too.
Yeah.
Yeah, good point. It is.
go ahead,
Yeah.
Liz.
There are some things to consider. Usually I don't know if you've looked at getting those permits and stuff, but usually you have to have some proof of insurance. You have to estimate the crowds and say what the burden would be, for example, on public restroom. There's some stuff to consider. And so it doesn't mean you can't do it. And I mean, people do it all the time. But it might be something where having a school do it like partnering with the school and then letting the school use all of their, insurance, et cetera, might do something like that, or the daycare, et cetera. But there just are some things, usually those forms. But you guys are already the government, so maybe you might not have to worry about it. We were a private charity, so we had to fill out all that stuff. So anyway, but it's not hard. And it's not designed to be burdensome. There's just stuff usually you have to just check off. So if that helps.
Thank you.
Have you thought about, Nicole? I guess my strong suggestion would be the Winnebago County Community Park. I mean, it's big enough. Parkview's close. It's gonna be during a weekday. I should be open to anything. I'm sure Adam Priest, the park director, would give you a break because you're a county department. That's what I would suggest, it's centrally located.
I love that idea too. Part of what we were hoping to do, the intergenerational, is to have a daycare when they're out with their little buggies walking. So like with the Leo Wash Trail and the county park, I don't think realistically we're gonna get a daycare to bring their kids to a park to do it. Would they walk one of these areas that they're right there? Sure. And again, this may end up snowballing into a bigger and bigger event, like Liz said, but for this particular year, I think it's going to be a lot smaller, and it's just that, one flower for every 10 cases of abuse, and just acknowledging that it's significant in our community, and maybe having some local representatives speak at it, which again tells us we want to do it at like a South Park or a downtown or the boat place, because if we're going to get some local representatives, they're probably not going to travel to us to get to it. So it's lots of pros and cons, but just letting you know that we are having an event. We are going to acknowledge it in a different way. We used to put pinwheels out in front of our building that the kids used to like to take with them as they were walking by. And it really, unless you were driving by our building and saw the sign, it really wasn't much of an acknowledgement. So I love the creativity of doing something more substantial.
And we did a bake sale. And so we raised $250 in our bake sale just within our building. So that's our budget. And then festival donated $50. So we have a $300 budget for the event, which is the biggest budget we've ever had
Yes, it is.
of any events. So it's like very exciting.
It's super
But
exciting.
it's not 4,500 people budget.
No, we were thinking like, okay, have a bake sale, win, get $50 to contribute to this thing, and $250 later. Yeah, so we're gonna do something and we'll keep you posted.
Do you have a
I'm
date?
sorry, I shouldn't have brought that part up. Sorry about that.
You're gonna jinx us.
What is the date of it again?
June 15th. We don't have the specific time yet because we really were waiting to find the location and then A, see what times they'll let us do it. And B, really, we really want the intergenerational part. We really want the kids to be involved with holding the flowers. Because one of our goals for our ADRC was to like try to host some intergenerational events, and we haven't been really successful in that, but very exciting. So we've been partnering with the YMCA to do a food culture connection every month. And I have gotten contact with some schools, and they have some immigrant families who are willing to have their kids do some demonstrations this summer. And so we're working that out. So we will hopefully be able to have a couple of intergenerational food demonstrations coming this summer when school's off. And the families are excited to be involved in it. So it's slow but sure.
Yeah, definitely making progress. And then Brian, did you have anything that I
I was
didn't
just gonna
cover?
ask, are you looking to get a little media link for that, like so that you could get this out in the community, like this is what we're doing, like whether it's Oshkosh Media or Fox 11 or.
Yeah,
might not be a
absolutely.
bad
As,
idea.
as soon as we know a date,
Yes,
a
I
time
mean, yeah, the time,
and a place.
which is why we haven't asked for speakers, because we can't get someone to commit if we don't know what time it's gonna be yet, so. Inching our way along.
I do have some stuff, if that's okay.
Fire away.
Just to kind of give you, I've been giving you data every month as to what we're staff is doing. We had 51 enrollments to Family Care and Iris in the last month, and that's humming along really good. But when I look historically, there are other months in 2021 that we've had that many packets. So I don't think that part of our data is showing us that we're uber busy compared to last year. But what I've kind of condensed is the amount of time we're spending on a functional screen, which means when we're talking about options counseling, that's where we should start with people. And Beth and I have talked initially about this, but we are inordinately jumping to doing functional screens more than other counties. And that's interesting to me as to why is that? There can be several reasons why. We're an aging population. People are coming to us later in a referral so that they're needing help immediately when they come to us. We're still trying to discern why that is. But I'm actually, one of the things that the state has us do is observe our staff to do the options counseling and enrollment counseling meetings. That's one thing that I'm starting that already here in March to kind of understand and hopefully coach that. It feels, as an ADRC, certainly options and enrollment counseling to Wisconsin's long-term care programs is something we do. But there's a lot we can do before that. And other counties, at least from a data perspective, seem to do more than that than Winnebago County. And so that's a little bit puzzling to us. And so I think that's I'm not sure exactly if our data is telling us that perfectly, but that's something that's kind of piqued our interest on why we're, inordinately doing more functional screens than other counties. So that is something that we'll be trying to discern. I did reach out, I kind of looked at the note from Outagamie County. They put their notes in their Human Services Board minutes for how many packets and stuff that they do. I do know that we tend to do more enrollments than Outagamie County. And I don't know population wise, I think Outagamie County is still bigger than us.
Oh, yeah.
Yes, it is.
So that's interesting to me. And I think, that has made.
20,000 bigger, I believe.
That has made me a data geek, so I think that's telling us something, and from a coaching perspective, I think that's interesting to us, and I think. Leading our staff to be asking different questions and maybe not jumping towards those public programs, I think is where we need to be here in 2023.
Outagamie is Winnebago is a Generation 3 program. Outagamie is
They're the same, I believe, aren't they?
Seems like it seems like they are Gen 3 as well.
okay.
I think they started around the same time as us. I'm pretty sure.
But I think what we're looking at doing is we've done our way of doing business since 2010. And I think we've realized with some of the staffing things and is that still the best? And so looking at different options on how to take on calls and rotate on call and those types of things. Our staff is sort of asking for that a little bit, and we're trying to be still obviously run the programs. The dog wags the tail doesn't wag the dog, but still be amenable to understand where the frustrations are in the job and how we can help that along for our staff. So I think 51 packets is really a good number. It's not making us any busier than we were last year or maybe even in 21. With that functional screening, the level of functional screening is something that's really concerning to us. So Rob mentioned I was at the Oshkosh Committee on Aging meeting. What they specifically wanted to know of the ADRC is we have since January 1st, we have a new option that's available to customers in our community, and it's family care partnership. So we've hummed along with family care since 2010, and that helps you with your long-term care, the help that you need into your home or paying for my assisted living if I can't be home safely anymore. Well, family care partnership is that, but it's also involves your doctor and your nursing and your prescription medicine comes through the family care program as well. So it's a little bit more wraparound type services than we've had. And we've had 2 people enroll to it. The unfortunate thing about being an ADRC, you don't get to follow up with them to say, hey, how's it going? We only ever hear when they disenroll because it isn't going well. So it would be nice. That's kind of one of the problems of being an ADRC. We kind of lose that ability to communicate with them once they become a member. So not really sure how it's going just yet. You can understand that some people, you know, just want the help that's coming into their home and they want to manage the rest of their life. They don't want any part of the rest of it. And some people say, here you go, manage the whole kit and caboodle. So that's just the difference in human beings. And so now we have that option here.
Well, I
As of
I will differ. I will say that, the difference between the two is that you can hire or fire an IRIS that compared to family care.
Sure.
Because I'm, well, I'll let you finish up what you're saying. Before I launch into my tirade.
Okay, so we're kind of stepping back to family care versus Iris, and certainly, yes, Iris does allow you some more leeway. Essentially, you are your own case manager. So as Rob mentioned, you can hire the staff that you choose. You can let them go if you want to. There's all of that is in family care that comes from an interdisciplinary team. And so along the kind of continuum of control, Iris would probably give the customer, the member, the most control versus family care partnership. Someone's going to be taking care of most facets of their life. So that's obviously, we're all different people, so that's attractive in different, you know, degrees to different people. So
And family care though does have self-directed supports where you can hire and fire your own staff. So you can choose family care as your support model and still have that ability to hire and fire. It's just that the decision of how many hours, pay, things like that are dependent upon the interdisciplinary team versus just you. But just, okay.
Well, and Ryan or Brian, to piggyback on the jumping to functional screens, like one of the things that we're doing is we are starting something called community conversations, where we're trying to get out of this building and check in with people in the community and answer people's questions and talk to people about being proactive and talk to people about talking to their family about what do you want? And let's start having these conversations early. And like, what do we do? What can we do so that it doesn't have to be reactive, that you're not coming to us in crisis, that we're helping you so we can avoid those things. And so our first one is April 3rd. We're going to be at the YMCA. And so we're testing this out because we're trying to reach out to a demographic of people who maybe don't want to come into this building and who maybe have questions. And so we can be easily accessible in the community so people can feel comfortable so that they can talk to us. And so we're having someone from crisis, someone from public health, myself, one of Brian's staff, and then an elderly benefit specialist. Yes. And so we're hoping that we can do this more often. If we can get people to see if people are interested in that, because we'd like to be able to maybe go to a school, maybe go to a church and be able to take this on the road as a panel of experts to connect with people so they can feel comfortable. Like you said, Harold, to like be able to ask those questions like, hey, I go to the senior center and this is going on, like what's happening, so that we can hear what's going on in the community, no matter what age people are, if they have a developmental disability, if they are elderly, if they have a child with mental health issues. So that way we can kind of reach out to you in the places that you go.
Yeah, that presentation I did yesterday was a variety of people who were older adults, a mom of someone with a developmental disability, autism. And again, it was on their ground, their territory, so.
Are you reaching out to that sandwich generation that has young kids and they're guiding their folks?
Yeah, we've tried to do presentations that like, what is it, that mutual, like some insurance company. We've done some companies that where you're talking about that sandwich generation who work there. So we've done some I'd have to check to see which companies we did them with now, but some companies that employ predominantly that generation to talk to them about what we've done and what we've not done. To be blunt, we haven't done one very recently because we haven't been fully staffed. So, you know, how much do you?
I'm just wondering if you're over at the Y and that's where you're advertising this event. Probably have a lot of sandwich generation people there. already.
Exactly.
Yeah.
And if you
Yeah.
appeal to them on that level,
Yeah.
want to know what to tell your parents about planning?
Yep, and that's really kind of part of the conversation. Our plan is, instead of telling people what we do. We are going to share a story from each of us and different ways that we've helped people that people might not know about. So like hopefully sharing a story will make people think like, oh, my neighbor, or oh, wow, my daughter, really just to connect with them. I did a presentation, or I did a women's group at the Oshkosh Corporation last year, and there was like 40 women that ended up coming and talked about those kind of things. And a lot of people were worried about their elderly parents and just had questions like that. And so that's our hope, is to kind of reach out to a demographic that might not be reaching out to us until it's a crisis, to start having family conversations and community conversations. And like when you see a concern with your neighbor, calling us instead of waiting until becomes a crisis. And so we're hoping that takes off so we can find those people all over the community. And we're going to try to do Neenah next. So we did doing Oshkosh. Maybe the Y has been very good to us of like doing marketing and promoting and allowing us to come for free and, taking part of the onus of the work that it takes to put into these things. And so that's why we're starting with the Y, but we're really open to making it a big thing.
I have two questions. What time is it on that day? And then
11 a.m.
11 a.m. And the other question is where? Why?
Good question. The 20th Street Y.
Okay.
When you say the Y, you're talking Oshkosh?
Yes.
Okay.
Initially, but then like she said, the Neenah YMCA has been really a good partner too, so that would probably be the next.
Okay, I saw they do a lot with St. Paul's across the street.
Yes, they do. Yeah, it was actually the Neenah Y that reached out to us to do the free respite, which is held at St. Paul's. So yeah, great partnership.
I think Corinna had something in the chat. I saw.
Oh.
I want to check that. Quick. Specific to functional sleep.
Just a second. Yep, I was reading that one first.
Good point. Number of calls we received from hospital case managers requesting functional sleep due to lack of placement options for their patients.
Well, true, but I was just on a call earlier today with where two other parts of the state were saying the same thing. So it's comparing one ADRC to the other, so that wouldn't really explain why ours is more. Granted, we've got 3 hospitals in this county, but all the other ADRCs are getting the same. One lady said that there was a woman who was in a hospital for 90 days because they couldn't find placement for her. So, but it's a factor. Thanks, Corinna. It is a factor. But like Brian said, it's probably many things. Our other ADRCs putting their data in different. Are we getting our referrals later? We do have 3 hospitals. Not every county has that, but yeah. All right.
Yeah, I got 2 comments. We're always trying to sell ADRC to the community. And one thing, every now and then there's a blurb on my TV where Brown County's ADRC puts a little blurb on the television. And the other thing is what I'm wondering about. There's a city bus that runs through my neighborhood. And on the side of it, there's a sign saying big letters ADRC. I don't know what else it says. There's the bus is moving. But I'm wondering, when you just print something out there that says ADRC, a person doesn't know what that represents. So how do they know that that committee might be able to help them or their relative?
Yeah, the state is supposed to be working on some branding and marketing at a state level. So regardless of where you live in the state, that means something to you. That they've done promotional materials, but they haven't actually done a TV ad for us or anything like that. We did do a video telling about us that we could start maybe utilizing in a different way. I don't know, but maybe put it on OCAT or something like that.
What
Well, right
TV
now,
channel was that on?
Bus, the sign on the side of the bus, if I wasn't on this committee, like walking down the street and I see it says ADRC, I wouldn't know if that's something I needed help with or not.
Agreed.
I mean, now I don't know.
Hmm?
Well,
I agree.
uh, Yeah, it said, again, the bus is moving, so you gotta, unless you can read super fast, I can. But if it somehow, instead of having big letters ADRC, if they had big letters adult and disability, at least right away, okay. I know right away what, if it applied to.
No, you're right. I'm looking at our website to see if the video's out there,
But I didn't,
but we could. Yeah, it's, you're absolutely right, Harold. The ADRC doesn't mean a lot to our community, that we could use some work in that regard. But you just triggered something when it comes to media about utilizing the video that one of our interns produced, Michelle. I don't know where that is on the site.
I don't know when Brown County puts theirs on TV, if they get that free or not, I don't.
Yeah,
Brown County goes to private.
Yeah, I know it's private, but maybe the TV station does it for them free anyway.
yeah, they are generation one, they are not part of the county, that kind of stuff, but still, it's worth taking into
Which goes back
consideration.
to what we talked about earlier. Do they operate under the same rules we do, or because they're private, they're a little bit different?
They don't have the same rules that we do.
Thought-
So that is a
brought up
factor.
earlier.
Again, that's not an excuse, but it's a factor.
Well, and that's one of the things we've been talking about. So Beth and I and Elisa are working with Fox Valley Memory Project on a grant that we have to provide awareness. And one of the things, and specifically on dementia, but also to have people come to the ADRC if there's concerns. And one of the things that we talk about is we don't know, we're not media specialists.
Right.
So we don't know what the best avenue of how to educate people and provide awareness is. We're kind of just plugging away thinking like, you know, like to send people mailers cost $20,000 and send everybody a mailer. We don't have $20,000, but if we did that, would it work? We don't know. And so we're really open to feedback from anyone of like, what would work? Like what, if we did have money, which we don't, but if we did get a grant or applied for a grant and had money to provide awareness, what would help people to, like, would it be mail? Would it be TV? Would it be radio? Is it billboards? Like, what would be the best way to provide awareness?
And Fox Valley Memory Project is actually hiring somebody to do that for us, is to say, what is the best mode? You know, we're gonna have to then put it out there, but they're actually hiring somebody to assist us with marketing. Cause it's not, you know, I can sit here all afternoon with ideas about what to do, and I might connect 1/10 of the population that I want to. So we want someone who knows this business to do it. The other thing I just wanted to add, that we can certainly do something else with, but for people who, any of you who are listening to this that want to let someone know what the ADRC does, if you go to the internet, our website, under About Us, under additional resources, there is a link here that you can refer people to so that they can, that's the state video that was done. And then sure, our video would be out there. Well,
Did we pay for that sign that hangs on the side of a bus or painted on the bus? Did we pay for that?
We got a grant,
Okay, but I guess my point is
but yes, we paid for that.
that you might get somebody's attention if it's spelled more like adult and disability committee
Yeah.
as opposed to ADRC.
Mhm.
That's my point.
you're absolutely right.
Is there any value to having a grant?
You don't hear that often enough. You just goading me, so I'll say it again.
Does the state have, do they support us? From a technical, do they have a resource person that we could ask about media and say, what do you guys?
Yeah, they don't have a media person or a point person, but if you click on this additional resources, you'll see that they do have, the state does have a video. They do have some promotional materials to help us with it.
Well, I was thinking of answering Nicole's question.
Is there any value to have a partnership with ADRC and UWO business school business, branding, marketing. Much like we did with the,
Have them do a class project or.
yeah, class
whatever.
project or whatever to say.
That's a really good idea.
It is.
They did quite a bit for the community foundation.
Maybe they needed an internship.
I'm
They could do our
willing-
marketing.
I'm willing to do draft school services. Pretty good at that.
I think if you reach out to them now for the fall semester, you might be surprised. They did a lot for the community foundation
Yeah,
on a lot of different levels.
it's an awesome, that's a great, I will reach out to them.
Because it's intergenerational. Seriously, it is.
Yes, it is. It absolutely.
And they're the ones that are gonna know social media.
I don't.
I know it's.
I just learned what geofencing was. Like,
You have to tell me about that. I don't know.
it's way beyond my pay grade as a social worker.
Okay, I'm done poking around here.
Okay.
I'll have to find the video.
All right. Any other questions, comments? Liz, Jan, or Tamara, anything from you? I think then we will. Unless there's anybody else, going once,
Move to adjourn.
going twice.
Question. Is this the